Hi, my name is Nancy Talam. Um, I'm going to present to you education on care of pressure ulcers as fulfillment of oral comprehensive examination requirements, Dr. Peg Rooney, June of 2019. My picot question. In nursing fundamental class, does instruction in the use of alternating pressure mattresses for non-ambulatory patients result in students relying on technology instead of doing patient repositioning during a 5-week clinical rotation? Significance of the issues. As nurses, we form the largest professional in nursing practice, and adapting to technology can be challenging at times. And for successful implementation of technology, it requires us as nurse educators to be able to embrace the new technology. That way we can influence the students in adapting technology. Adaptation of alternative air mattresses prevent pressure ulcers for sure. Pressure ulcer is a major problem in the United States and affects about 3 million adults, which is a very significant number. And this complication results from lack of repositioning. Pressure ulcers are very costly, very expensive, and it is noted that 2.5 times more than preventive costs. It is noted that 9.1 to 11.6 billion US dollars, a lot of money is being spent to be able to cater for the cost of pressure ulcers. Pressure ulcers has resulted to lawsuits, litigation from families suing companies because of pressure ulcers. Poor nursing education is the baseline, is the platform of everything. It is our responsibility as nurse educators to teach nurses about the care of pressure ulcers. It doesn't require one person to be able to take care of pressure ulcers. It requires multidisciplinary approach. It requires the nurses, it requires the healthcare providers, it requires therapy, speech therapists, dietitians to work together to be able to manage pressure ulcers. It is very vital to expose nursing students of the use of the new technologies to be able to improve the management and reduce cases of pressure ulcers. Education on the use of alternative pressure ulcers versus 2-hour repositioning. Sometimes it is not practical to turn a patient who is very heavy every 2 hours. It causes a lot of energy, a lot of time, resource to be able to turn patients who cannot turn themselves, who cannot move by themselves. As nurse educators, we have to promote the use of alternative pressure mattresses, especially in nursing facilities nowadays. There's shortage of nurses. So it is not practical to have nursing assistant or a nurse turning and repositioning patient every 2 hours. So as nurse educators, if we educate nurses, we'll be able to reduce medical services cost, reduce the duration of stay, and avoid litigation. This will save us a lot of dollars. A case study. RL is a 71-year-old Caucasian male who presents with pneumonia and difficulty walking. He uses a wheelchair for mobility with one-person extensive assist and it requires two-person assistance for transfer. It requires two-person extensive assist with bed mobility. Turning and repositioning RL takes two persons to turn and repositioning while in bed. He exhibits a lot of pain with positioning due to the pressure ulcer. He also wears TED hose for DVT prophylaxis. He has poor solid food intake. He suffers from stage 1 pressure ulcer. He has pain and discomfort during pressure ulcer dressing change. A nursing student is caring for RL and she's really concerned about Mr. RL and tells the preceptor that an alternative pressure mattress could take place of repositioning her patient every 2 hours and could help him feel more comfortable. The preceptor agrees. The patient is placed in air mattress eventually. Educational nursing theory applied to education. So I picked Rogers' theory by Everett Rogers. Rogers applied theory of diffusion of innovation, which is very useful in implementation of new technology. And this theory had 4 qualities, which is relative advantage, compactability, simplicity, trialability, and observable results. With any technology, embracing it can be difficult. So as nurse educators, we need to help nursing students accept technology so they can use, for example, the alternating pressure mattress over repositioning. This will save nursing students a lot of energy and be able to prevent pressure ulcer eventually. Rogers' theory guides nurses on steps to allow the acceptance of new technology. It is difficult to have change, but Everett Rogers' theory allows nurses to be able to embrace a new technology without difficulty. Master's Essential of Academic Nurse Educators. This essential demonstrates and engages in ethical and legal practice in teaching and learning activities. It also allows evidence-based decision making, which allows nurse educators to maintain current skills and knowledge in theory and practice. Another essential is integration of technology into practice. It allows the nurse educator facilitate learning in practice and educational setting. Leadership. As nurse educators, we must be prepared to lead. For you to lead as a nurse educator, you need communication skill and cultural sensitivity. Collaborative care is also another essential, and this involves multiple specialists working together to bring about a change, to bring about a positive outcome. It doesn't require one person to do it. We need to work together as a team to be able to manage pressure ulcers. Quality patient care advocacy and quality improvement in nursing education is also another master's essential of academic nurse educator. Core competencies of the academic nurse educator: facilitate learning and learner development by providing a positive environment, a comfortable environment for the students so they can be able to learn. Use assessment and evaluation to measure student learning in clinical settings. As a nurse educator, we have the responsibility of ensuring that we assess nursing students and evaluate them in any setting, be it a class setting or a clinical setting. Nurse educators also participate in curriculum development and evaluation of program outcomes. They also act as a change agent. They take leadership roles in different systems and organizational levels. Pursue quality improvement. As nurse educators, we are able to critically think, to be able to bring solutions to problems such as pressure ulcers, as well as engaging in scholarship so that they can demonstrate skills and abilities in educational principles for evidence-based practice. Another core competence is educational environment. Demonstrate effective communication for scholarship and function. And this is the evidence table where it shows 80 randomly selected 65-year-old and older, where they were being turned every 2 hours in their last week of life, and it was noted that 91% were at risk of developing pressure ulcers. And repositioning them every 2 hours was not enough, and it led to 34% of these elderly senior citizens died from pressure ulcers. This shows that turning and repositioning is not enough. We need the use of technology to assist us in performing the turning and repositioning and preventing more pressure ulcers. Alternating pressure air mattress as a prevention for pressure ulcer, a literature review. It is noted that alternating pressure mattress were likely to be more effective than standard hospital mattress, but there was no conclusion that was reached about their comfort. The author, as shown in the slide, advocated for nurse educators to teach and train the students in the use of air mattress correctively. That way they are able to prevent pressure ulcers. So the use of this equipment is very vital. Educating nurses on the correct way of using it to prevent pressure ulcers development. There's gaps in research, and one of them is limited studies on the effectiveness of educational strategies on the reduction of incidence of pressure ulcers. Research required to increase the knowledge and understanding of pressure ulcer prevention strategies through seminars for nurses. Another gap is there is a need of increased education to prevent development of pressure ulcers. Implication for advanced nursing practice as a nurse educator. Understanding choice of technology improve nurse educators' performance. To be able to embrace this new technology will allow the effective management of health conditions and professional growth. Bridges the gap between research outcomes and practice within healthcare system. This will enable the nurse educators connect research with practice to improve clinical practice through education of nurse students. This will bring about quality of care and safety for our patients. Case study follow-up for Mr. Arel. So with the use of alternative air mattress, the pressure ulcer was healing at the end of the 5